Hi learners, you are welcome to this session of nursing care to a patient with carcinoma of the prostate gland. It is session number 8, continuation of the previous session on the care of a patient with cancer and tumor. I have said today is nursing care of carcinoma of the prostate gland. By definition, the cancer of the prostate gland is a disorder in which the cells in the prostate gland become abnormal and start growing uncontrollably and forming the tumors. It is formed in tissue of the prostate. And prostate, this is a gland in the male reproductive system which found below the bladder and in front of the rectum. The prostate cancer usually occur in old men, but not must. The causes of cancer of the prostate gland are not clear, but like in the enlargement of the prostate gland, there are predisposing factors, among of which are 1. Maturation process during puberty. The prostate gland enlarges rapidly until the age of 30 years. From the age of 50 years, the glands also change in size, change in consistency, and firmness. The changes in size and the consistencies of the prostate gland is attributed to, kwanza, increased tissue mass resulting from the cellular proliferation, increase in hormone androgen and estrogen, which stimulate its growth. Another increase in the enzymes 5-alpha reductase, which converts testosterone to dihydrotestosterone. Hii kazi yake ni kustimulate prostate growth. Factor nyingine ni repeated urinary tract infection or sexually transmitted infections. Age. The disease is rare before the age of 45, but it can occur in men over 65 years for about 70%. Family history of the prostate cancer and genetic predisposition. High fat diet, lack of exercise. Here I have pictures which shows the normal and location of the prostate gland. As you can see here we have the prostate. Testes and penis is here, urethra, prostate glands is around here. Look here, it is the rectum, so it is in between here, the prostate gland. Kiangalia vizuri, utaona kama kuna kitu enlarge kidogo hapa. Ya mengine ni seminal vesicles and the lymph nodes. Hii ni picha ya kwanza. Ya pili, unaona kama kuna tofauti kidogo. Unaona urethra, unaiona, alafu unaona prostate kama zimeenlarge kidogo, alafu hapa chini juu yake kuna bladder, seminal vesicles tunaziona na rectum. Therefore, this picture shows the prostate and the nearby organs. The picture number 1. The second one shows how the prostate surrounds the urethra. Now the pathophysiology of the cancer of the prostate glands. The prostate is part of the man's reproductive system, and as I have said, it is located in front of the rectum and under the bladder. The prostate surrounds the urethra, the tube through which urine flows. A healthy prostate is about the size of walnut. If the prostate grows too large, it then squeezes the urethra. This may slow or stop the normal flow of urine. na hili ndicho kinachowaletaga wagonjwa hospitalini bila wao kujua kwamba they have prostate cancer, lakini kinachomleta ni kwamba mkojo hautoki. The prostate gland is it makes part of the seminal fluid. During orgasms, the seminal fluid helps carry the sperm out of the men's bodies as part of the semen. The cancer of the prostate gland is commonly adenocarcinoma. Adenocarcinoma, which develop as a hard localized nodules. Growth is generally on the outer portion of the gland's contractions of the urinary bladder, and the voiding symptoms are not common until the cancer has advanced. Therefore, unaposema adenocarcinoma here, this is the cancer that arises in the gland, forming tissues. The cancer may rapidly spread out the capsule's boundaries from its original site and be spread through the lymphatic and the vascular system to affect the other organ, the distant one. The most common site for this metastasis are the bones, the pelvis, the lumbar and the spine, the femur, and the ribs. In the late stage of the disease, there may be involvement of the lungs, involvement of the liver, involvement of the kidney. Some of the prostate cancer might be detected by the rectal examination even before the symptoms appeared. Baada ya hapo sasa, the patient can start presenting the following signs and symptoms. And this symptom initial stage of illnesses. In advanced stage, the signs and symptoms may include palpable mass felt on rectal examination, elevated blood glycoprotein, complaint of stiffness, back pain, and hip pain. Nyingine ni urinary flow obstruction as seen in the benign hypertrophy of the prostate. Fikiri mlisoma kwenye medical condition. Severe bladder irritation, urinary frequency, nocturia, blood in urine, urinary retention, hip or back pain, weight loss, and kidney failure. Sasa baada ya kupata dalili hizo, tutafanya nini sasa ili tujihakikishie kwamba this is really a prostate cancer? Ya kwanza, as a diagnostic measure ni tunafanya blood screening. Blood screening for the prostate specific antigen, PSA. This test is not, remember, this is not specific to cancer. It is specific to prostate. PSA, prostate specific antigens. Any condition such as infection, either enlargement of the cancer, will cause elevation of the PSA. Kwa hiyo huwezi kujihakikishia kwamba hii sasa ni cancer of the prostate. It is not a confirmatory test. Pengine tunaweza kufanya rectal examination, digital rectal examination, which will reveal that there is a hard and palpable mass. Kati tunafanya hivyo rectal examination, it determines the enlarged prostate. You can feel for nodules which may indicate cancer or tenderness. Sasa ikiwa ni tenderness, hatuwezi kusema kwamba sasa hiyo ni cancer. Inawezekana hiyo ni tenderness kwa sababu labda pengine infection. Lakini kingine tutakachofanya ni X-ray examination, which might demonstrate whether cancer has spread to the lungs. X-ray. Nyingine ni bone scan. A small amount of radioactive substances will be injected into a blood vessels. That substance will travel through the bloodstream and collect into the bones. A machine called scanner makes picture of the bones. Because a higher amount of the radioactive substance collects in areas where there is a cancer, the picture can show cancer that has spread to the bones. Nyingine ni CT scan. The picture from a CT scan can show a cancer that has spread to the lymph nodes or to other areas. Nyingine ni MRI. Nyingine ni transrectal ultrasonography, where an instrument is inserted into the rectum to produce an image of the prostate. Nyingine ni obtaining a tissue sample, biopsy. Nyingine ni lymphadenectomy, where you can perform pelvic node dissection. This is done to detect whether cancer has spread. Now the nursing care and treatment of patients with cancer of the prostate gland. Kitu cha kwanza muhimu sana ni issue ya active surveillance. This consists of closely monitoring the patient prostate cancer by performing the PSA and DRE. DRE stand for digital rectal examination. Regularly, this can be done and treat it only if and when the prostate cancer causes symptoms or shows signs of growing. Sasa modality nyingine tutakayotumia ni surgery, radioprostatectomy. Prostatectomy is surgery to remove the prostate completely. Radical prostatectomy remove the prostate as well as the surrounding tissue. Modality ya tatu ni radiation therapy. Radiation destroy cancer cells or prevent them from growing by directing high energy X-rays radiation at the prostate. There are two types of radiation therapy. Ya kwanza ni external radiation therapy, where a machine outside the body direct the radiation at the cancer cells. Second, internal radiation therapy. Tunaita kitaalam brachytherapy. Radioactive seeds or pellets are surgically placed into or near the cancer site kwa lengo la kudestroy the cancer cells. Modality nyingine ni hormonal therapy. Hormonal therapy, baada ya kupata drugs, surgery or other hormones to remove male sex hormones or to block them from working, which prevent cancer cells from growing. Other therapies used in the treatment of prostate cancer that are still under investigation, moja ni cryotherapy. Hii ni placing a special probe inside or near the prostate cancer kwa ajili ya freeze and kill the cancer cells. Chemotherapy, using special drugs to shrink or to kill the cancer. The drug can be pills, which you take, or medicine given through an intravenous tube, or sometimes both. Biological therapy, another modality. This is the treatments work within the body immune system, so that unaiwezesha immune system of the body to fight cancer or to control the side effect from other cancer treatment. Kumbuka hii ni kuboost immune system. Side effects are how your body reacts to the drugs or other treatment. Biological therapy is different from chemotherapy, which attack cancer cells directly. High intensity focused ultrasound. This is therapy which is directed a high energy sound waves, ultrasound light, at the cancer to kill the cancer cells. Kingine ni orchiectomy, castration. This may be done to suppress the testosterone. Now the nursing care. Sisi kama wauguzi basi tafocus katika eneo hili. Kwanza tuhakikishe tunamsaidia mgonjwa na familia yake. To encourage the health diet, lishe bora, plenty of fruits to prevent constipation, and the proteins to promote healing process. Provide psychological support to the patients and family. Explain the diagnosis and all cares that can be directed to the patient. Lengo hasa ni kupunguza woga. Explain the side effect of the treatment and medication to promote compliance. Lakini kwa kuwa tumeona kule juu kwamba huyu mgonjwa wetu anahitaji surgery, one of the modalities is surgery, kwa hiyo tunaweza tukamwona preoperatively. Through explanation of the procedure to the patient is done to help him understand and alleviate anxiety. Ensure the cleanliness of the patient. Patient should sign a consent form. Laboratory investigations are clear, are done, and are recorded to the patient file. And the postoperatively, follow the routine postoperative care procedures. Make a quick assessment to the patient, determine the level of consciousness, check and record the vital signs, inspect the wound for bleeding and the gaping, make sure the drainage tube or catheter infusions are working well. The Foley catheter should be draining well and will be bloody. If a large clot, check with the doctor, as this might cause blockage of the catheter. Check the signs of increased bleeding. Check the scrotum to assess for swelling from fluid collection and or blood. Keep a record of intake and output. And you also perform passive exercise. Promote sexual function by reassuring the patient that sexual ability will return gradually. Monitor for signs of water intoxication. Now, the complication of a patient with carcinoma of the prostate. Retention of urine. Mara nyingi sana retention of urine inatokeaga, na hii ni kwa sababu ya obstruction. Blood, bleeding in the urine, infection, blood clots, hernia, impotency, this is erectile dysfunction, metastasis from the original sites of cancer to other tissues, pain and depression. Postoperative complication, moja tunasema anaweza akapata impotency, sterility, and the patient can be impotent for many months and often permanently. Nerve damage, which may lead to inability to control urine, unapata sasa incontinence of urine, hemorrhage leading to anemia, and wound infection. Prognosis, maendeleo yao huwa ni mazuri tegemeana na stage ambayo mgonjwa amekuja na amepewa huduma ya matibabu. In men under 17 is more often rapid and progression, and it leads to metastasis and subsequent death. Hii sasa inakuja mara nyingi, nimesema wanakujaga late sana mpaka wagundua kwamba wana prostate cancer. Unakuta tayari imesha metastasis, imeshaenda kwa haribu sehemu nyingine, imeshaenda labda kwenye lungs, kwenye brain na sehemu nyingine za mwili. Most prostate cancer in men over 70 years is slow, and the progression may not require the treatment. Key points: cancer of the prostate is most common in elderly men and carries chance of metastasis, and treatment may include combination of surgery, radiation, and medication. Thank you very much for listening, and I wish you all the best. Stay safe, do your work. Na tumaini kwamba next time nitatoa assignment, naomba basi nitaituma kwenye Google Class yangu ili muweze kufanya hiyo assignment. Asanteni na washukuruni sana kwa kunisikiliza.